Since the reopening of schools, over 80 confirmed positive COVID-19 cases have been recorded across Tobago's education system. This data was shared on Monday by Education House Office Dr. Dane Joseph of the Division of Education Research and Technologies Health Unit.
Out of these 88 cases, 82 cases were students and teachers, whereas 6 were staff at the Division of Education. A further breakdown revealed that 33 of these cases were amongst our secondary school students, whereas 49 cases were among the primary school students.
Dr. Joseph explained that 52 cases were from schools in Scarborough and environs, and 14 from the north and 16 from East Tobago. Meanwhile, Secretary for Health, Wellness and Social Protection, Dr. Faith B. Yisreal, noted though in the past children were not being adversely affected by the COVID-19 virus compared to adults and those with comorbidities, over the past week a change has been recognized.
Identified at least 2 confirmed cases of children who were COVID-19 positive and who became very, very, very ill. We have a situation where we've had at least 2 confirmed cases of what is known as Miss C. Miss C, and Miss C refers to multi-system inflammatory syndrome in children, which in essence says it is your systems, your respiratory system, your heart and your lungs and all of these different parts of your body become inflamed.
And the rollout of the pediatric Pfizer COVID-19 vaccine for children aged 5 to 11 years old will begin tomorrow, Wednesday. Minister of Health Terence Dialsing said the vaccine will be available at 30 sites throughout Trinidad and Tobago. These include some of the health centers and 4 mass vaccination sites. Speaking on the Now Morning Show, Minister Dialsing reminded parents and guardians that they must walk with a valid form of identification, the birth certificate of the child, and proof of relation to child for guardians only.
We have given parents all the information that they need to get their to get their kids vaccinated. We do have cases in schools. It's not a cause for alarm at this point in time, but we can mitigate further cases in schools if we start to get more of about 12 to 18 vaccinated, and also now 5 to 11. Because the worst thing you want to do, Kimberly, is to keep children away from school. It is not good for their long-term social development.
It is hoped that the vaccination of this age group would also reduce the number of COVID-19 cases in the school system, but the minister said some parents are still reluctant to get their children vaccinated.
Remember, even with the 12 to 18, we only have about 60% of them vaccinated because too many parents have bought into the anti-vaxxers message. And it's a global problem, but we just ask parents to believe in the science, trust in the science. The anti-vaxxers do not have your best interest at heart.